The fact that it's conservative. The various tips that are available for it make it very easy to make minor, I won't say incisions, but to remove just the amount of bone you need to remove to get to either the sinus, to get it to the wisdom tooth, to get into the periodontal ligament to extract teeth. But mostly it was with sinuses, because if I put a rotating burr on the bone and it slips, or our retraction isn't as good as it could be, and you get a rotating bone caught up in the soft tissue, you damage the soft tissue quite a bit. Whereas with the piezo surgical unit, you touch the soft tissue and there's no problem. It doesn't hurt the soft tissue at all. It takes a little bit longer, but not much. With sinus lifts, you're going in, doing a lateral sinus lift, cutting out that little block of bone. I didn't want to perforate the membrane. So it was beautiful for that. That's how I started using it. I did a lot of wisdom teeth. I do a lot of wisdom teeth. And getting back that far in the mouth with a rotating burr can be difficult. So I love it for those things. I mean, it's an integral part of our surgical armamentarium. Well, it's just because people haven't been told that it's a great way. You bought the unit, might as well use it more often. Otherwise, the traditional way of doing it is with a manual luxator to loosen the tooth, cut out the periodontal ligament, whatever you want to call it, to be able to lift the roots out of the socket. With this, it's very, very gentle. You go down around the tooth in the periodontal ligament and you separate it from the bone. This particular case had a very thin buccal wall. You might see it on the CT scan I showed you. And because the patient is contemplating implants, I didn't want to lose any bone. And I was afraid if I had used a forceps, by luxating the root with the forceps, I was afraid I might break the buccal bone, which would make it more difficult later on to place an implant. So it was excellent for doing that. As you also saw, the tooth was very decayed. There was a lot of decay around the tooth. There was a little bit of root fracture there. And I was afraid that with a traditional manual luxator, I wouldn't be able to get purchase there to get the root out. So this was much easier to do it. It might have taken 3-4 minutes longer to work your way around, but that's it, and it's definitely worth it if I can preserve some bone. And as you saw, the patient had no problems with it. You get that little ultrasonic sound, but they're used to that from scaling and polishing. And it doesn't give the same vibration that a rotating burr would give. Now, I wouldn't use a rotating burr in this case, but for wisdom teeth or for sinus lifts, that we're used to using a rotating burr, and that tends to vibrate a lot more, and the patients, very rarely like the vibration of our instruments in the mouth. I think I have, 12, 15 different tips. You can see those little burr holders or tip holders I have. And there are different ones to use, and it depends if I'm cutting bone, if I'm scraping bone, if I'm gonna try to release the membrane from the sinus to be able to do a sinus lift. They have a full range of tips. The thing is, you just have to look in the catalog, or you have to have your rep show you the tips to show how you can use the unit. But if you're investing in any kind of equipment, you might as well use it to its fullest. To sell it to people, it's a very flexible unit. It's very gentle to both the bone and to the soft tissue. You get very little bleeding when you're doing any kind of surgical procedure. And if you're doing more than just simple extractions, surgical procedures just other than simple extractions, it's worth having it. I leased it over a number of years. I can't remember how many years. You have to talk to my wife. She's in charge of that as practice manager. But the cost per month is minimal compared to the amount I can use it and the things I can use it for. I know I've definitely been with them since I opened this practice up in 2011. So I knew Alex, and he let me try some of the contra angles drills, and I love them. They're robust. They feel good in my hand, and the service I'm getting from Alex and his reps is just top notch. It's not the bottom line that counts for them. It's the clinical excellence and the service behind it. That's the most important for them, at least here in the UK. And I love the range of drills or handpieces they have, I guess is the correct word. Yeah, and as I think I mentioned before, I almost never use a turbine. I have several turbines in house, but I use the high-speed contrangles, the red ring contrangles is what I call them. My nurse says, just get me another red ring. I have a number of those in office, and most of my associates are using those too instead of using the turbines. You get more torque, you get the tactile sensation is much better. The tactile feedback is much better than you'd get for a turbine. So those are my preferred handpieces.